Welcome to AJP Audio for July 2025. I'm Aaron Van Dorn. Today on the podcast, I spoke with Dr. Tanner Bommersbach of the University of Wisconsin School of Medicine and Public Health and Dr. Greg Rhee of the University of Connecticut and Yale University's School of Medicine. Dr. Bommersbach and Dr. Rhee are authors on a paper in the July issue of the American Journal of Psychiatry looking at trends in suicidal ideation and suicide attempts in a large cohort of American high school students with and without high-risk behaviors. Afterwards, I once again speak with the journal's editor-in-chief, Dr. Ned Kalin, about the rest of the July issue. Dr. Bommersbach, suicide is one of the leading causes of death for adolescents aged 15 to 19 in the United States, and data has demonstrated a concerning rise in both suicidal ideation and attempts in this cohort. Your study looked at these trends among high school students in the United States from 2007 to 2021. What can you tell us about it?
Well, as you mentioned, Aaron, there's been a lot of attention on the data showing a large rise in suicidal ideation, suicide attempts, and suicide deaths amongst adolescents over the last 1 or 2 decades. But what is less known is whether this rise has been broad-based, occurring among the entire adolescent population, or whether the increase has been more narrowly confined to certain risk groups. And in this study, we focused on behavioral risk factors that have been shown to be associated with suicidal behavior in adolescents. So we specifically looked at 24 different health risk behaviors like substance use, victimization, getting poor and inadequate sleep, and high-risk sexual activity. And we used data from the Youth Risk Behavior Survey, which is a large national survey of U.S. high school students that's performed every 2 years by the CDC. We looked at trends in suicidal thoughts and suicide attempts from 2007 to 2021 among 3 specific groups of adolescents, those engaging in a low, moderate, and high number of risk behaviors. So in the low risk group, these were students engaging in either none or just one of the 24 different health risk behaviors we examined. And then on the other end of the spectrum, the high risk group, these were students who were engaging in at least 4 or 5 different risk behaviors. And our main finding was there was a general trend in which suicidal symptoms were most common among students in the high-risk group, but suicidal symptoms have actually been rising as much or more among students in the low-risk group. And again, these were students engaging in either 0 or just one of the risk behaviors. So the results suggest that this recent rise in suicidal symptoms that we've observed has not been confined to youth with established behavioral risk factors for suicide, but actually appears to be rising at least as fast among youth with few or no behavioral risks.
Dr. Rhee, the numbers you found were shocking, with a quarter of students in 2021 reporting suicidal ideation and with 1 in 10 reporting a suicide attempt. But those numbers were not evenly distributed across the sample. What can you tell us about how those rates varied among gender, racial, and sexuality lines?
That's a great question. So we found that the suicidal ideation increased the most among females as well as among white and black students as compared to Hispanic students. And similarly, suicide attempt also increased most among white and black students. However, the rate of suicidal ideation and suicide attempts were particularly high among students identifying as gay or lesbian. Nearly 50% of students identifying gay or bisexual and those suicidal ideation were planned in the last year, and 25% reported a suicide attempt. So these students report extremely high rate of suicidal symptoms.
Were these trends consistent across the study period, or did they increase with the COVID pandemic era?
So the numbers had increased since they collected the data on the sexual orientation in the survey data. So the number of suicidal ideation or suicide attempts has increased dramatically from 2015 through 2021 linearly.
As I just mentioned, your study period ends with the height of the COVID-19 pandemic, which was obviously particularly impactful for teens as they were out of school and they were socially isolated. Are there lessons that we can draw from what your study found about that inflection in your data?
The data showed an especially large rise in both suicidal thoughts and attempts from 2019, just before the onset of the pandemic, to 2021, which, as you said, was really at the height of the COVID-19 pandemic and was a period that coincided with rapid changes in the social environment for adolescents amid stay-at-home orders and other disruptions. These findings that we found were consistent with other large studies in the US and other countries across the globe, which underscores the universality of mental health impacts for adolescents during this period. One finding from our study that was particularly interesting was that adolescents who engaged in the highest number of risk behaviors actually showed the largest increase in suicidal thoughts from 2019 to 2021. And so this may indicate that the COVID-19 pandemic may have disproportionately impacted students with already elevated behavioral risk profiles.
You've mentioned earlier some of the behavioral risk factors that your study looked at, including substance use, screen time, and sedentary activity. How did those factors relate to suicidal ideations and attempts in your data?
One of the strengths of this study was that we were able to examine 24 different type of risk behaviors that have been shown to be associated with suicidal symptoms. And we found several that were especially associated with suicidal ideation and suicide attempts, including being bullied either at school or electronically, using substances including especially cannabis, and engaging in high-risk sexual activities, as well as getting fewer than 5 hours of sleep per night. So the students with these risk factors were most likely to report suicidal ideation or suicide attempt. And in regard to the screen time, we also found that the high-risk screen time, which means spending more than 4 hours a day on social media or using video games, was associated with suicidal ideation but not suicide attempt.
Are there clinical implications for your study? Not just for clinicians dealing with patients who have suicidal thoughts and behaviors, but for anyone working with this cohort?
Our results showing that the recent rise in suicidal symptoms has not been confined to youth with established risk factors for suicide, I think has potential implications for how we screen for suicidal symptoms among adolescents in medical settings. There's been much debate about whether we should be doing universal screening for suicidality, meaning we screen everyone that comes into the office, no matter their risk factors, or whether we should be doing more targeted screening, meaning only screening adolescents who possess certain behavioral risk factors like substance use and mental health concerns. And currently, targeted screening strategies tend to be the most common strategies that are employed in medical settings today. However, our findings showing that suicidal symptoms are rising as much among students without behavioral risk factors for suicide suggests that these targeted screening strategies are likely to miss a growing number of students with suicidal symptoms. For example, 10% of students in the low risk group in our study reported suicidal thoughts, and 3% of students reported attempting suicide in the past year. And it's likely that all of these students would have been missed by these more traditional targeted screening practices. The results of our study are also consistent with other prior studies that have shown that a large number of adolescents who screen positive for suicidal symptoms in primary care do not have mental health concerns and may have been missed if not asked about suicide directly. So I think our findings highlight a need to better study the most effective ways of identifying students who have suicidal symptoms in medical settings.
You were looking at behavioral risk factors, and did you see any sort of inflection in the rate of certain risk factors during the COVID-19 pandemic when your data ran into that? For example, maybe screen time was increased in a cohort versus maybe bullying fell off as these kids were more socially isolated and less interaction with peers.
I think that's a great question. We didn't look specifically at that. And because we were only examining rates from 2019 to 2021, I don't think our data is really granular enough to examine specific trends in certain risk factors. But it's a great question.
Well, moving on from that, what are the limitations of your research?
It is important to highlight that the findings from a national survey and that it is subject to self-reporting bias, which may have resulted in either over-reporting or under-reporting of suicidal symptoms. And also that this study is observational, and so we cannot say what may be causing the rise in reporting of suicidal symptoms among adolescents. It may not be that the suicidal symptoms are actually more prevalent, but it may be that adolescents are more willing to disclose these symptoms due to reduction in mental health stigma, for example.
What's next for your research?
Well, I think we need more rigorous studies and large-scale trials that test the most effective ways of screening for adolescent suicidality in medical settings. In recent years, the U.S. Preventive Services Task Force has found that the evidence for universal screening for suicide risk in adolescents specifically is insufficient, meaning there's not currently adequate evidence to recommend this practice.
Mm-hmm.
Nonetheless, the American Academy of Pediatrics and other professional organizations currently recommend universal screening for all adolescents in medical settings. So this is an area where we need more empirical evidence to help reconcile and guide our clinical practice.
Excuse me, Dr. Bommersbach, Dr. Rhee, thank you for taking the time to speak with us.
Thank you for having us.
Thank you.
Up next, Dr. Ned Kalin. Dr. Kalin, welcome back to AJP Audio for July 2025.
Thank you, Aaron.
Earlier in this podcast, I spoke with Dr. Bommersbach and Dr. Rhee regarding their paper looking at national trends in suicide attempts and suicidal ideation in high school students in the U.S. What can you tell us about it?
Aaron, this is an interesting and important paper, and perhaps the findings will not be surprising to our readership. But what this study does is it basically looks at suicidal behaviors and suicidal thoughts from 2007 to 2021, looking at trends and changes over time in high school students. Basically, in this study, they included almost 120,000 individuals from a database. What they found in this study was that in 2007, for example, roughly 14% of the students said that they had suicidal ideation in the past year. In 2021, that increased to about 22%. When looking at suicide planning, the incidence in 2007 was about 11%, and that increased to almost 18% in 2021. So a marked increase in both ideation and intent. And then when they looked at attempts and just asked people about whether or not they actually made an attempt, this increased from about 7% to 10% over that time period. So again, I don't think it's a surprise. Suicide is considered the second or third leading cause of death in adolescents and young adults. But what is of great concern is the increase in incidence of suicidal ideation, intent, and actually attempts. And one of the things that was interesting about this is that they also looked at behaviors that are associated with increased risk in adolescence. And these fell into a variety of categories, including a history of violence, a history of substance use, sexual activity, being overweight, physical activity, and so on. And they found that these risk factors tracked basically the increase in these suicide-related behaviors and ideas. But what they also found was that whether you had one or two of those risk factors or more, it didn't seem to matter as far as your increase went. And also the greatest risk factor, risk behavior, was actually having a weapon and actually carrying it. And again, that's not particularly surprising, but it greatly increased the odds of suicidal thoughts and attempts. There's a really good editorial that accompanies this by Dr. David Brent and Jeff Bridge from Pittsburgh and Ohio State University, respectively, where they talk about these findings, they put them into perspective, and also they really emphasize ways to continue to hopefully reduce the risk of youth that may be suicidal.
Regarding reducing the risk for youth who are maybe suffering from suicidal ideation, is there something that clinicians currently working with these groups should take from this paper going forward?
I think that there are a couple of things. One is just as a reminder of the high prevalence of suicidal ideation and thinking in this population.
Mm-hmm.
So as I mentioned, in 2021, from the sample, it was 22% of individuals endorsed suicidal ideation of high school students. So this is, obviously quite high, and it may be even higher because people may not want to admit that. So I think being aware of it, asking about it as always, taking preventive measures, and then also asking about these risk-related behaviors. And to the extent that they're there, really trying to talk about those in relation to the increased risk that they can confer to an individual and helping think about how to reduce sort of the associated risk with some of these behaviors. There's a lot coming on board about using machine learning and other types of methods to predict individuals, including adolescents who are at risk. Some of that work hopefully will come to fruition, but most of it is really not ready for prime time right now. I really would encourage our readership to read the editorial because it does get into that question that you asked specifically.
Up next, we have a paper from Dr. Müller and colleagues taking a look at self-control and problematic internet usage.
Yeah, this is an interesting and very timely paper. We're all, very attuned to the internet issues.
Doom scrolling, they call it.
Doom scrolling, yes. And most all of us are probably feeling like we may be involved with the internet more than we should be or want to be.
Sure.
We're all concerned about young children and the internet and impacts of all that. This is a study that looks at what they call problematic internet use, basically. And it is a study that looks at whether or not individuals that have different levels or degrees of, quote, problematic internet use also have issues with controlling their sort of cognition from the standpoint of impulse types of control, response inhibition. So being able to inhibit your responses in a way when you feel like, compelled to do something and your brain says, maybe I shouldn't do that, but you do it anyways, that kind of thing. And that's very much related to thinking about why people develop addictions, that they can't effectively inhibit some of their prepotent kinds of mental thoughts that they have about using a substance or something like that, or a cue that's associated with that. And of course, in the lay press and other places, problematic interuse has been talked about as being very similar to other substance use addictive types of behaviors. I think there's some of that, there's some controversy with that. Nonetheless, this study looked at this issue and they used a measure called a structured clinical interview for internet-related disorders. They categorized individuals into different types of internet use disorders: gaming, shopping, pornography, or social networks. They had as a sample about 1,000 internet users ranging from ages of 16 to 65, so it wasn't just youth. They also broke these groups down into different levels of severity. So they had a group that they considered non-problematic use, a group that they considered at risk, and a group that they considered pathological internet use. They had predefined these groups, but when they looked at these three groups, they found that the pathological use group was averaging about 4 hours a day of internet use compared to 3 hours a day for the risk group, and for the non-problematic use, approximately 1.5 hours a day. But I should say that this isn't just any internet use. This is really highly focused on whatever it is that they're into, whether it's gambling or pornography or gaming or whatever. So it's not just sort of scanning around the internet. Also, what's interesting is that the pathological group also reported more psychiatric symptoms. They reported having more anxiety, more depression, more obsessive compulsive types of symptoms. And it also was found that with all the neurocognitive measures, or most of them that were used, looking at response inhibition, looking at something that's called salience attribution, how they value certain types of things, all of those factors were significantly worse in the pathological group than the other groups. Now, having said that, the effect size or the magnitude of the effect was quite small. Okay, so it was worse, significantly worse, but a small effect. And also importantly, none of these individuals were out of the range of normal for these measures. So they differed. In other words, they were somewhat worse, but they weren't whoppingly abnormal. So what this suggests is that, yes, people that overuse the internet and are very focused into these specific areas as if it's sort of an addictive type of behavior do have some cognitive control issues that we can identify, where perhaps they are less likely to inhibit certain responses and things like that. But it's not really in the very pathological range either. So it's a hint at some issues. It's not clear whether this is a consequence of being deeply into the internet or it's actually a risk factor for doing this. And that's the same issue with drug abuse or addictions. Some of these cognitive control issues are thought to be both some predisposing risk as well as something that happens after people continually use some substances. So it's an interesting study, very timely, significant effects, but again, not dramatic. And also there's a really good editorial here by Dr. Aviv Weinstein from Ariel University in Israel, where he challenges the idea that all problematic internet use is similar to addictive disorders, and also puts some of these findings in perspective.
Following that, there's a paper from Ahn and colleagues looking at alcohol use in psychiatric disorders.
This gets at the question of whether or not individuals that have problematic alcohol use and also comorbid psychiatric problems, which are incredibly common, have in part a basis for this because they share these two types of disorders, share the same genetic underpinnings. What this paper does is it basically uses a very large sample that it puts together of individuals of European descent. It's almost 435,000 individuals. And they do a GWAS study looking at whether or not there are specific gene alterations, SNPs, that are associated with problematic alcohol use. And problematic alcohol use is defined here as including a variety of types of things, such as having a diagnosis of alcohol dependence or substance use disorder, fitting into the ICD-9 or 10 alcohol-related codes, and also having a score on an alcohol-related test called the Audit P. which identifies problematic alcohol use. So that's the group. So they found that there were about 6,000 genes or gene alterations that they could identify that were significantly related to problematic alcohol use. Now, they also looked at 11 psychiatric disorders and looked at the genes that were associated with those disorders, and then basically looked to see whether any of the genes were shared across alcohol problematic use and the psychiatric disorders. And what they found is that a number of the psychiatric problems actually shared genes with problematic alcohol use, ranging from a 39% to a 73% overlap in the genes that were altered. The two that stand out were schizophrenia and major depression, and they share a significant number of genes. So this may be one reason why we see such high levels of comorbidity. People with alcohol use disorders frequently will drink alcohol because they're depressed. People who get depressed will frequently drink alcohol because it helps them feel better. So that may be one reason. They also identified some specific genes, which they talk about. I won't get into those now. And they also thought about how to use a statistical method to link the genes to causal comorbidity between the two illnesses. Now, again, there's a really good editorial that accompanies this by Drs. Mallard and Smaller from Harvard Medical School, and they really get into this in more depth. One of the findings that came out in this study was that autism spectrum disorder also shared genes with problematic alcohol use, and that is something that the editorialists challenge and really don't believe based on some of the findings in the paper, the results, and other literature. So again, I would recommend not only taking a look at the paper, but taking a look at the editorials.
And finally, we have a priority data letter from McCabe and colleagues, which brings us back to high school, and in this case, looking at trends in drug usage among U.S. adolescents between 2009 and 2022.
Yeah, so this is an interesting study. I think it's sort of a bit of a shining light. You know, we just talked about the increased incidence of suicidal behavior and thought in adolescents. This is a study that was trying to understand the extent to which adolescents that are prescribed and also illicitly use controlled substance is changing over time in youth. Okay. And so the data that was used was all from seniors in high school, 12th graders. And it's a data set called Monitoring the Future. It's a national data set. It's supposed to be representative of nationwide sample of adolescents or high school students. They looked at data ranging from starting in 2009 going to 2022. And in 2009, they had about 4,500 participants, and that jumped all the way up to 24,000 participants in 2022. What they found was that when they looked at the medical use of stimulants, so that is prescribed stimulants, and also benzodiazepines, that the amount of use did not change over that period of time, it stayed pretty stable. Okay? But what was really quite interesting, well, also when they looked at the use of opiates or opioids for pain control, that went down from 17% to 7%. And that's consistent with, I think, with the overall, national efforts to reduce the use of opiates, the opiate epidemic. But when they looked at the non-medical use of these drugs, that is sort of the illicit use, and this is again self-report, what they found was that opiates went from approximately 8% to 0.7% over this time period. Benzodiazepines went from about 4.5% to 1%, and stimulants went from about 5% to 1%. And it also, when asked about whether the adolescents were getting a prescription and then selling it or giving it to other kids, that's called diversion, that was much less likely to occur in 2022 than it was in 2009. So this is really nice news. It's news that prescribed opiates are going down in this group, and also the illicit use of these drugs, at least is by self-report, seems to be considerably less and has been going down as well.
Well, Dr. Kalin, thank you for taking the time to speak with us today.
It's a pleasure, Aaron. Thank you.
That's all for this month's AJP Audio, but I hope you'll join us again. In the meantime, check out the other podcasts from the APA, including Psychiatric Services from Pages to Practice. In the most recent episode, Dr. Dixon and Dr. Bearson spoke with Dr. Ben Brody about healthcare accreditation and how it can more closely align with patients' interests. That and more can be found at psychiatryonline.org or wherever you get podcasts.
The views and opinions expressed in this podcast are those of the individual speakers only and do not necessarily represent the views of the American Psychiatric Association. The content of this podcast is provided for general information purposes only and does not offer medical or any other type of professional advice. If you're having a medical emergency, please contact your local emergency response number.